Assalamualaikum and greetings to lecturers and all my friends. Today I'm going to explain a little bit on physical examination process. So basically the first thing that you need to do is the general examination, where we simply observe the animal behavior, and from there we can assess the mentation, whether the animal is quite alert responsive, whether it's bright alert responsive, or whether the mentation is stupor or in coma state, and etc. And then we can also observe the posture and also the gait of the animal by allowing the animal to walk around us, and from there we can see if there's any asymmetrical of the animal limbs, and which can affect the way of the animal walking. And then we can also assess the hydration status of the animal by simply pulling part of the skin of the animal, and it is preferably to do that on the loose skin of the animal, which is abundant on the dorsal part of the animal, particularly at the neck region. It is by pull the part of the skin and then allow it to retract to its original position, and we have to calculate the time taken for the skin to retract back to its original position, and it is considered normal if it's only take less than 2 seconds. And then once all the general appearance examination has been done, we can move on to the vital parameters examination. And firstly, the vital signs includes the mucous membrane of the animal, and this can be assessed by observing the oral cavity of the animal. And the oral cavity, the mucous membrane of the oral cavity, we can observe whether it's red, pink in color, or bluish in color, which indicate the blood perfusion of the animal. And then from there we can also assess the capillary refill time by applying extra pressure, a little bit pressure by using your finger on the mucous membrane of the oral cavity, and then see whether on how long the blood refills the area where you apply the pressure before. And it is considered normal if the blood refill the area in less than 2 seconds. And then we can move on to we can auscultate the heart. And auscultation of the heart requires the use of stethoscope. And the auscultation of the heart, we need to auscultate the heart at the region between the 4th and the 6th intercostal space. It is advisable to do on both side of the thorax to actually obtain the potential maximum intensity of the heart rate itself. And here I demonstrate on how to do auscultation of the heart. And we should take the heart rate for 1 minute for the precise number of the heart rate, or in other way we can just take in 50 seconds and then multiply it by 4. And then from here we can also assess on if there's any abnormalities of the heart rate sound, if there's any murmur, or also arrhythmia of the heart rate. And from here we can also auscultate the lung sound. And from to auscultate the lung sound, we need to take on 4 different areas. It is advisable to do on 4 areas, 2 on the dorsal left and right, and also the ventral left and right. Here I would demonstrate on how to auscultate the lung. So as you can see here, the dorsal part, we can auscultate here and here, and we should also auscultate here, and also on the right ventral. So from here we can actually assess if there's any abnormalities on the lung sound, such as wheezes, crackles, or also rails, which may indicate if there's any problem with the respiratory system. And then we move on to the third vital parameter, which is the temperature of the animal. And the temperature of the animal we can take by using our thermometer and insert it into the rectum of the animal. And this should give us the exact temperature of the animal itself. And the normal temperature for both dog and cat is between 38.3 to 38.8 degrees Celsius. Okay. Then once all the assessment of the vital parameters is done, we can simply do the physical examination in order from head to toe. And from head, we should assess on the, okay, so if we start from the ear, and we should see if there's any parasites, or we can also smell if there's any abnormal smell of the ear. And we should also take note if there's any discharge or also signs of inflammation and infection. And move on to the eye, we should also assess the same kind of thing, such as if there's any discharge on the structure of the eye, which includes the conjunctiva, the pupil, and then if there's any from the lid, from the eyelid. And then we move on to the nostril, and we should see the conformation and the symmetry of the nose itself. If there's any asymmetry of the nose, it should indicate there is mass on the nostril. And then we move on to the oral cavity, and we should inspect the structures in the oral cavity, which includes the teeth, and then the tongue, the buccal mucosa, and also other related structure in the oral cavity. And then we move on to the thorax area. And firstly, we can palpate the whole spinal cord, the whole yes. And then by allowing our finger to go cross through the spinal cord, we can actually feel if there's any abnormalities, and if the animal shows any signs of pain. And then along the thorax region, we can also, as I mentioned before, auscultate the heart rate, and we can observe if there's any abnormality of the sound of the heart, such as if there's any murmur or if there's any arrhythmia of the heart rate. And as we are talking about the thorax, we can also examine on the lung sound of the animal, and if there's any abnormalities of the lung sound, such as wheezes, crackles, and also with rates, may indicate there is a respiratory problem. And now move on to the abdomen examination. The abdomen examination, we can simply put that the abdomen is divided into three parts: the cranial abdomen, the mid abdomen, and also the caudal abdomen. And then by simply running our fingers through the abdomen of the animal and let the organs slip through our fingers, we can actually assess the size, the location, and the position of the organs inside the animal, inside the abdomen. And along that, we can also actually examine if there's any abnormalities, such as if there's any presence of fluid, and also if there's any changes in the size of the normal organ. And then lastly, we move on to the genital area. If it's on the female animal, we can assess the mammary gland. If there's any reddening, the mammary gland should be located ventral of the abdomen of the female animal. And if there's any abnormalities, we should note if there's any swelling, redness, also pain, and lastly heat emitted from the structure. And if it is a male animal, we should examine the prepuce and also the scrotum of the animal. If there's any discharge, masses, or also abnormal symmetry of the testes of the animal. And then of all that, we can also examine the limbs of the animal, and we can also take note if there's any swelling, also abnormal mass on the limbs of the animal. I think that is all for physical examination of small animal, and thank you for listening, and thank you.